Good afternoon, everyone. We're the clock roaders, so we started off with regular hands yesterday, and after the whole night, it's disintegrated into claws, and we're just kind of trying to do with what we have. So, so our project's name is Helping Hand 2.0. It was 1.0 yesterday, changed. Yep. So imagine this situation. You know someone you love, you care for, who is misusing opioids. You can't confront the person, you can't talk to the person, you're feeling uncomfortable about it. So what do you do? So this is where Helping Hand 2.0 steps in. Next slide, please. So we see that deaths related to opioid is pretty much concentrated around the states which have the highest rate of opioid prescribers. So what does Helping Hand do? So if you're a family member, if you're a friend, whoever wants to help out, logs into this application, this web application, and kind of reports this misuse of opioids. So basically what you're trying to do is you're trying to tell the whole community of doctors that this person is misusing opioids. Please restrict the flow of opioids to this one particular person. So how does this happen? So the doctors, they have this, system that we've also made. It's like a patient management system almost. So whenever the doctor gives out an opioid, what the doctor does is he creates a user profile for this person, telling this database almost how many opioids have been given out, about his history, and it just has a whole history of the whole patient over there. Now, so this is the overall solution. So what we're trying to do is we're trying to mitigate the overprescription of rates of opioids. Over here. Next slide. All right, so talking a little about the theme. So here the theme of Helping Hand is basically treatment. We're drawing upon all from these data sets that have been provided by Socrata. And we address the idea of prevention via the statistics which are given from these above data sources. Next slide, please. All right, so let's talk a little bit about creativity. So what this patient management system does is it'll basically shed a light on the flow of prescription habits and the history that will be in one single repository. So this doctor or any other doctor can go on to log into this system. He can see the past history of this particular patient. He can see if this person has been prescribed opioids before, how many dosage has been given to him, how many days are left, and also in the patient the doctor can actually judge themselves as well based on an average. So the doctor can judge his own average of giving out opioids based on the state as well as the whole country. Next, coming to Helping Hand, what we're trying to do is we're trying to reach out to the community. This is based on social network, social connection rather than network. So this is your little form that you have to fill out, and this is going to give you the nearest centers that are there that you can reach out for help. So going to the next slide, so this is a bit of the user experience over here. This is the application that you develop. The doctor, the person who's trying to help out can log into the Find Help app, fill out all this information. Let's go. Fill out all this information, get that data, get a behavior analysis of the person that they are trying to report as well, do a little analysis between both of this data, and kind of get a report of this person as a whole, just to get updated into that database that we have. Yeah. This is for help. Yeah, move on. And so this is your, thank you for your help, and you get this whole interactive Google Map API where they tell you what's happening. And this is basically a dashboard of everything. So this is from a patient's perspective. So you kind of get your whole tracking and your whole opioid usage, how much opioid has been given out to you. So this is an absolute dashboard of everything. So moving on to the next slide. So now let's talk a little bit about sustainability. So with the increasing statistics of doctors, this can only make the whole system much better, right? So the more information that we reveal, the more accurate the whole system is going to become. This is also going to take help from the community. So you're you're kind of catching all these hidden cases based on community. And the system will only get better as time goes on. And that's our presentation. Thank you so much.
Given EMRs that are out now, how do you plan to have a doctor log into this and an EMR and and a PMP and all the other applications that they have to use on a regular basis?
So probably what I understand is how would you get the database of the whole, of all the patients? Is that what you're asking? No?
How do you expect doctors to use this when they have several other things they have to do on a regular basis?
So think about it this way. A doctor has their EHR open and they're documenting and working with a patient.
Yep.
Now you're asking them to open up a bunch of different things, yours included. They have multiple things at one time all on their screen. And this seems that it's pulling public information that the doctor then has to use, and then you're trying to get that information to port back to somewhere, which might be back into the EHR. Right. We're trying to figure out where everything goes.
So what probably the answer to this would be like a state mandate where you would have to use a unified system, where based off of all the information that you put in for the patient at the first go, it is going to give you out a dashboard of everything. So to the point where you don't have to put it on the EHR again. Do I make myself clear? You kind of use this, and then that makes the whole back end of it.
Okay, so to add to what he's saying, actually, what we implemented now is we are allowing to different type of users that can access our system. So maybe we can assign this job for the nurse or someone like assistant for the doctor itself. So by filling his AHR or AMR or whatever other forms, we can move this task to one can assist him in just like providing the data. The idea here is we are having a lot of data that provided to us, and we use this data to run analytics and to decide what we are going to do. But at the same time, we want to make the data more reliable. So if we can, once we prescribe the opioid or the medication, can register this on the system, and we are kind of regulate the thing by creating a profile for the opioid recipient or the opioid user, this will help us judging and preventing the opioid crisis. So what I'm trying to say here, it's filling the data can be moved to some kind of assistant for this doctor. So he hasn't to go through all these windows. Yeah.
Would you also have allow patients or non-physicians to create profiles and see utilization data also, or is this only for physicians?
Yeah, actually this is, we allow patients to create this kind of thing, but in this case, we are assuming that the patients have good intentions, but in our minds, we consider that the opioid abuser might be not the one who's creating his profile. So to assure this, we made the physician responsible for doing this, or the medical facility, and any representative from the medical facility. Yes?
So here, you're compromising your patient's privacy?
No. Continue, sorry. Okay, we can't, one of the things that we were discussing related to this is the medical records, how we are going to violate the privacy of the thing. So basically, our analysis or our system based on the physician data input. So whatever the physician is going to put inside our system, we are not going to run analytics, we are not going to, how can I say? We have a privacy statement that shows how we are going to run our analytics on this data, and this is for the beneficial, for the physician and for the patient, not shared with anyone else or any other patients. So the one who has access for this data, the patient, he can see his analytics based on the prescriptions he already taken, and the physician who treats this patient or someone he visited, like another.
They're taking information from the community to populate this, right? And the way that they know who to report about is based on that patient's name. And so you're putting a patient's name out there.
No. Yeah. Okay.
Any of the information that is pulled from the community itself is not going to be used as authoritative, and it's only going to be used as sort of a warning indicator for any of the people who do have access to these records.
All right, let's give it up for Team 14.
Thank you.
All right, good afternoon, everybody. We are Team SAP. I am Brett. I am. Hold on. Yeah, we're good. This is Joe, who's interrupting me. This is Abay. This is Kelsey, and I'm going to hand it over to Sarah, who's going to kick us off.
So in 2016, fewer than 3 in 10 adults with opioid addiction received any treatment. So as you can imagine, this was our area of focus today for the last 24 hours. In order to address this issue, we've created an application, an easy-to-use application that intelligently matches a patient to the best treatment option for them. Our hope is that we could produce cost savings in treatment and opioid-related deaths, but overall improve and save lives. We'll do this by reducing the number of treatment episodes, easily assess access to treatment, and improve the time to successful recovery. I'm going to hand it over to Joe to talk a little bit about our data.
Sure. So we took, we took 2 data sets from SAM. So we took the TEDS data set, which is discharge data. And the cool thing about the discharge data is that at the end of it, it has outcomes. It tells you, were they successful? Did they go to jail? Did they get transferred to another facility? It's a little more complicated than that. But having a set of data with outcomes means that you can use the inputs to kind of do a predictive model to track what the outcomes, what caused the outcomes. So we looked at, drug use characteristics of the person themselves, their history, their demographics. And so we fed all that into a couple different predictive models. And you can see on the right what we came up with. This is in order the characteristics of from the discharge data that showed in order which ones were most. I don't want to say the word. Deciding, but they were correlated. So there's a correlation here between these models. So it's going to take a little more work to kind of figure out how the whole thing works. 24 hours isn't enough time, but we were able to build a matching engine, and that's the goal here. So what we took was the most predictive elements of the TEDS data. We were able to generate a setting, and we were able to generate a length of stay. So those are the 2 things we focused on: setting and the length of stay. And then we were able to take the treatment, focus in on the treatment options, and try to match the patient with what the best treatment options would be based on the setting, the length of stay, the services the facility offered, the drug use habits of the people themselves. So I'll jump right to the demo because we're out of time. But if you want to ask a question about it after.
Okay, thanks, Joe. So when we looked at this, we wanted to analyze rural versus urban, and you can clearly see here that the circle size and color is the death rate. And in the rural areas, there's extreme problems like there are in some urban areas. So it's not exclusively about cities. There are issues across the board, rural versus urban. And when we drill in, you can see that in some of these rural areas, there's not a single treatment option available. So we got to get to how can we help those people, wherever they live, find the right treatment option. So we built an application, and this is all about me as an individual and my story. How can I be matched to the right treatment facility no matter where it's located? So I simply go through and pick the options that apply to me. We'll do this very quickly. How many times we've been in treatment.
The options match back to the predictive variable.
Yeah, these match the model to help solve the issue. Have we been arrested? Thankfully, no. Primary source of income. I live on my own. Which drugs? Obviously a big factor in determining the right match for treatment. Secondary and even tertiary drug use as well, and how often you use it. Oh, wrong button. Rookie mistake. There we go. Then you review it, and it comes back with the right type of facility, the right duration, and beyond that, it actually matches you up to the optimal locations, regardless, again, necessarily of of where you are. That's a factor, but not the only factor. They're trying to match it up to the best outcome that you can see there.
Here, you want to go to the next? Oh, Brad, stop. So we're going to take questions, and you can read our last slide.
What determines the confidence level that you had listed?
So we tried a couple different models in the predictive model. I want to say it's predictability, but it's correlation. So they correlate. And I don't know if you've seen the TEDS data. The TEDS data, we went through it pretty in depth for Louisiana. We've been doing a lot of work with Ohio. I live in Ohio. With Pennsylvania, some of the Midwestern states, because they've had the biggest problems. But Louisiana data is interesting because there's a bunch of it, and there's less of it, and there's a bunch of it, and I don't know if it's just treatment went down or if people stopped turning in their data. So it's a mix, you know. So
this is a pre-existing app, or is this an app built on an existing infrastructure? I believe you guys are using HANA.
We use HANA Cloud Platform, to do this HANA Cloud Platform, and so we built the model using our predictive analytics tool. We built the app itself using HANA Cloud Platform and our access. I was trying to shine a big light on her. She told me I wasn't allowed to. She built the app. And it built the underlying database is all HANA. So in the data sets, but we use the data sets, the TEDS data. We use it's all, you know, there's some issues with it. It's 2014 back, but it's 10 years of treatment data focused on, you know, treatments. I would say the one thing that we're missing, because it's 2014 data, is any kind of bats. So this is one thing I really wanted to get, was the influence of bats on you know, on the predictability of outcomes. And there's just not enough data yet. I don't think in there, given it's 2014, to know that. So. So the TEDS data shows really kind of transfers between sections, and it shows we look at just treatment success. So we looked at treatment success within the context of the episode itself. So we looked at the service setting at the intake and at outtake. So we tried to look at success within the context of that. So if one of the questions that we asked was, where, you know, tried to phrase it, where are you now? Are you going into detox? Are you getting out of detox? Are you, you know, where in the cycle of those things? I mean, the TEDS data, it's hard because it's you know, it's episodes. So they're probably the same person went through multiple steps in the episode. So the best we kind of could do was say within the current episode where you were, if you were coming into detox and you were going into, say, treatment, outpatient treatment, or whichever treatment you would be going into, looking at success, where you should go and for how long. So I wouldn't say it's a simplistic model, but it's the model best way we could build on a 24-hour period without doing a lot more testing. But the idea is that we take this and we get to wrap it up. I'm sorry. So I can talk about it for hours.
I know you. We know.
All right, let's give it up for Team SAP.
Okay, so good morning. We're Team 15, also known as Team Comp, not to be confused with the abbreviation for team composition, completely separate thing. And today we want to bring to you something a bit different than what you've been seeing so far, because we've been seeing a lot of different innovative ideas, which are really great, by the way. But they all kind of attack it from potentially similar angles, we think. So we tried thinking of a problem from a different angle and thinking of potential issues with it from that angle. So what we're providing is something called Private Taper. Our Private Taper app will focus on bringing the information to the individuals. A lot of approaches you've seen so far has talked about making people aware that they can go to people and receive medical help, and while receiving medical help is the #1 way to get treated, to my knowledge, it's not always the best. Because I say it's the best, but not always the best, because people either A, might not have access to it, B, some people don't like confronting people about it or being confronted about it, and C, it might just not be as convenient. Some people, they don't want to go out of their way to do it, and it would be way better if it was a lot more convenient. So we're bringing as much information as we can to them. Would you mind opening, please? Oh, okay, cool. So what we're providing is an application that brings data for tapering to people. And what they'll be able to do is they will be able to input, whenever they take any sort of narcotic, they can input what they're taking and the dosage, and it will log the time into a private file that will be encrypted and passcode protected anytime it needs to be accessed. And what we'll do is provide the option to just take it normally, and they'll input that data normally, but we'll have an option to taper. So you'll be greeted by a warning, letting people know this is not we're not associated with any medical institution. We're not doctors telling you this information. We got credible sources, and we will provide those credible sources for people interested in knowing why they might be wanting to trust this application. But seeking medical help is always what you should be doing, but people will not always do it. So we try to give them a backup, because it's better to do something instead of nothing for people who just won't get medical professional help. Oh, thank you. So can you bring up go to take a dosage, please? So they'll continue the menu, and for now we'll just go to take to show a quick example of what it might look like if they want to take a dosage of a medication. So for this example, they'll have a drop-down box of supported drugs that we keep data on, and so let's do codeine. So a lot of these, you might notice we might have a general thing like codeine, but then if you notice, there's a lot of prescription names for just medications that contain codeine, but they might be in different concentrations, so the different dosages might be different. Or if they list it, if it's a pill, they can list how many pills they're taking. If it's a liquid, they can list how many milliliters they're taking in order to appropriately gauge how much of the underlying opioid they're ingesting. And what they'll be able to do is they'll press take, and it will just register it in the private file, not being shared anywhere, local to their device, keeping their data secure only to them to access. And it will be encrypted by a 6-digit PIN as compared to a 4-digit, so a little bit more secure. And so then they'll have the option to, one thing that will make this really great is because of how easy it is to use. We want ease of use to be a #1 priority, because the more inconvenient it is to use, the more we will deter people. And we're trying to give people who don't want to seek professional help something to rely on. So we're trying to make it as easy as possible for them, because seeking self-treatment can be kind of painful. It's a lot of information, it's a lot to worry about. So we're trying to make it as simple as possible for them to use that information. So an average use, most people will be doing the same thing, same dosages over and over, or typically. So they'll have the take again option. So they can easily just click take again. But if you notice right here, a quick feature is, if they take any sort of medication, there will be a timer for 30 minutes afterwards, will be adjustable. And what happens is, okay, so what will happen is they have, if it's within 30 minutes, we'll let them know, hey, you recently took an application, just in case you forgot, you might be weary, you can cancel or you can go ahead and log it and go ahead with that. But one key feature we're going to do is whenever they feel like it, they can go to the taper. And if you notice, this is where the 6-digit PIN comes in, because when they go to the taper, it will suggest a dose to them if they want to slowly wean off what their previous doses were. So this will be based off, one, the underlying narcotic, and we process each medication differently depending on the dosages for it. And also, because the passcode protects it, they won't. It's really secure. He can't even get in, and we made it. And so this will expose some of the underlying data, which is why it's passcode protected, and this is their private information. But because he put in, I believe, 450 milligrams of codeine, based off how we believe codeine should be tapered, based off some data we read, and we will show you those sources very shortly, we would recommend 405 milligrams. Now, if it's a pill-based medication, we can recommend you take 4 pills, 4.5 pills. And if you go back to our information page from the main page, or you have history too, so you can also view history. If people want to keep track of doses they took in the past, they can see an entire list of every dose they took and when they took it, but also, once again, password protected, so only they can get to it, unless somebody's particularly smart and can figure it out. And then also, the information I mentioned, we provide all sources to any information we might use to provide tapering information. Anything we might use for tapering, we'll have links for. So that's all. Are there any questions? Yes. Yes.
I think this is a neat idea. What I thought was well done was you acknowledge the difficulty of this population. It's a very straightforward interface. I just didn't know if you've had any discussions or conversations in terms of your legal ramifications, because obviously you're going to have someone that's going to be adjusting a dose of medication without the input of a doctor. And you had a nice disclaimer there, but I didn't know if you had any thoughts about sort of the medical legal ramifications of an app like this of patients adjusting their own medications without the supervision of a physician. It is going down, but still, they could enter withdrawal, things like that. I didn't know what thoughts you had on that potential complication.
So one thing we did, though, is we tried to make sure we got very credible sources for the different types of medications and how they do tapering with them to provide amounts that normally don't cause withdrawal issues. Something we haven't have the chance to implement, though we will have a feature, or planning to, where they will implement if they're starting to feel poorly, if they're starting to feel withdrawal symptoms from what is considered to be a pretty safe way to taper down. We will reduce the amount by an unknown amount as of currently because we don't have much knowledge in that area, but we're planning to try to reduce it to be as slightly more gradual to adjust on the per person basis because not everybody can taper down the exact same amount and feel okay. There might be some people that might feel slightly worse. And as far as legal issues go, we tried to cover as many bases as we could think of, but not being too knowledgeable in the area, we weren't sure of ways to span all of it legally.
All right, good afternoon, everyone. We are Team 16. So imagine you live in Richmond, Washington, and you have a close friend to you named Andrew who confides in you that he has an opioid dependency issue and he wants to seek help. However, the closest treatment facility is an hour and a half away, but due to his economic status and his work schedule, he's not able to make that trip to get the treatment he needs. There are many people that are like Andrew. We want to solve the problem for rural areas where people like Andrew who need help but are not able to make those trips. So we've created a solution for that by creating an app for local officials to use to set up or to make decisions on places to place treatment facilities for those like Andrew.
Okay. So the solution that we came up with is an interactive web application. And this is going to be running in browser and hosted on Microsoft Azure. We're going to mainly be displaying two different things. We're going to be displaying the fatal overdoses per county in a specific state. So in this case, we're going to say Washington for our friend Andrew. And we will be displaying this as a bubble map on top of a Google map. And we will also display the current treatment centers that are available within that state so we can kind of see the correlation there, and it provides a very easy to use interface for the user. And so probably the biggest function that we have is the user's ability to drop custom markers onto the map. And what these custom markers allow the user to do is to plot a what we call prototype treatment center. And this prototype treatment center is going to have a certain heuristic function assigned to it. And the heuristic is going to look around it and be able to tell you whether or not this is going to be a very beneficial area to put a treatment center or not. And we will explain this a little bit more later. But the gist of it is that the higher the heuristic is, the better the location will be. So for theme, obviously we want to know, y'all want to know why we're here, what are we doing this for? So we're going to focus primarily on treatment in the rural areas. So with this app, we hope to identify areas that might be needing more treatment centers because obviously, and this is pertaining specifically to rural areas as well because they're usually lacking in them. Or you have, say, an instance where someone lives out of city and they have to make a large commute just to get to a treatment center when they really need the help as soon as they can get it. The data that we are using today is going to come from 3 different data sets, 2 from the Cajun Code Fest portal, and those are the heroin fatal overdoses, as well as the prescription overdoses. And then we are getting the opioid treatment programs from the SAMHSA. So for creativity, we want this to be a very user-friendly app, and this is going to be specifically for those stakeholders and these Medicare planners, people who want to find out where can I put a treatment facility that's going to best fulfill the needs of the people in the area. So to get more into the brains of this function in this heuristic that we're basing all of our judgments onto, we're going to get information in a 2-degree square, so that's about 120 miles around this projected area that we're going to let the user decide. And then we're going to do this simple function where we see, okay, however many opioid deaths are in this area, we're going to take the logarithmic reduction of it because we want to make sure that large populations do not skew this function as well. So in the case if there might be a large population, there will be a lot of facilities, and we want to scale this function down as well because we don't want to have too many facilities within one location. Okay, so this is kind of what our data looks like, and it's really gross. So we're going to go more into about what our app looks like because it looks a little bit nicer than that. So say we have Andrew who lives over in Richland, and there's no real providers in the area. The closest one's in Yakima, so it's about an hour away. But say we want to actually place a plot on top of it. So it'll tell us that the heuristic is returning a value of like 4. So this is saying that this is a pretty good area. Now, what you can do is you can place more markers in other places to say maybe we put a marker over here. Well, this is returning about 3 because there's a few more facilities in the area, but the deaths increase. So the idea is we don't want to cluster the facilities, but we want to make sure that there is access available to everyone. So we're able to move around, remove what we need. And that's basically all we have for that. So I guess scalability, it's pretty scalable. We're going to gloss over that really quickly, but I want to talk about spending reduction. So it's very expensive dealing with opioid overdosage because whenever you have someone in an overdosage, say in an ICU, this costs about $90,000, and this is per a single treatment. And this is costing the hospital a lot of money. Usually the patient can't afford it. Or even just a non-fatal abuse treatment. This is about $30,000. We really want to make sure that we limit this. But something that's very cheap to do is doing a $6,000 treatment for an annual treatment for a single patient is about $6,000, and that would be much more beneficial to use.
Give it up to Team 16.
Thank you.
Good afternoon, everyone. This is Team 21. I'm Matit. This is Madhu, my colleague, and this is my team. And we're here to present an app that saves lives. So our solution really is OPI help. And so our problem statement, like what we're trying to solve, is basically an early administration of naloxone, and I'll tell you what naloxone is in a minute. An early administration of the naloxone not being given to an overdose patient is proving fatal, not being given. And this mostly occurs 2/3 of the time when the patient or the victim is alone, is not with someone. So our app is trying to solve really 2 things. 1, timely access to naloxone, and 2, it gives it helps identify the overdose when the victim is alone. And a naloxone is basically something that treats the overdose. So you can think of it as a drug that can be given to a patient for an overdose. So we're trying to leverage the data sets from Socrata, basically to identify the behavioral health units that you will see integrated in our app in a demo in a few minutes. And also, it also has information about the naloxone refill centers, so that it can provide timely help to the overdose patients. So this is our solution. We have the app, which is OPI Health, and you can see that those are users or the victims that are suffering from the overdose, or they could sign up for this app, or it could be the witnesses, like some of the roommates who, or anybody from the family trying to help the overdose patient. They can sign up for the app. And it could also be the naloxone carriers, so who carry help to these patients. They could sign up for this app as well. And we're also trying to integrate it with any variable connectors or any local agencies like EMS, if they support that or any other local carriers that you will see in a minute in the next screen. So this is basically trying to integrate those connectors, the naloxone carriers, the witnesses or the victims as well, and then trying to help the solution for overdose victims. So our integration with the connectors, like this app can also be integrated with any variable connectors. Like these variable connectors I'm talking about could be IoT things, like it could be things like Fitbit, or it could be anything that could be wearable devices that could measure the respiratory system. So these symptoms that these overdose patients face usually is lower heart rate, lower respiratory things, and things like that. So anything that could monitor these over time with technologies that could include machine learning, we could scale this to include other technologies that could take data sets from even these IoT devices and then could integrate it with these apps so that it can get help from these naloxone carriers. Also, we could integrate this with Uber or Lyft or Waiter, any of these apps, so that they could be the carriers of naloxone for these overdose patients. So anything that you could see a witness trying to help an overdose patient, and you could request these naloxones to be brought to them. And we could also integrate it with other apps in the future. Yes. So the design is something similar to this. It's a simple design. All it does is you can sign up as an opioid victim or the witness for the victim, and you can also sign up as a carrier or the organization like health organizations as the carriers. And my friend here will show you the demo of the app that we've tried to build.
Yeah, thanks, Satit. Good afternoon, all. So before jumping into the app, I would like to tell about the sustainability of growth. So we can able to connect with many. We can design the wearable devices like a locket, as well as like wristwatch, so that it can able to monitor the heartbeat and respiratory system, so that we can create the model with the AI. So based on that, so it will able to trigger that notification that, are you okay? So it will give some beep for 60 seconds, sorry. So that if you are not okay, then it will automatically trigger a notification to EMS, then EMS people will respond. So that's how we'll get the immediate response. I would like to jump into the application. So this is what we have designed. So here, opioid user or witness can register that, and naloxone carriers, right now in the app itself we can register, but we can scale it up to third-party applications, as we said, Uber and GrabHub and something else. So if you are opioid witness or opioid user, you can able to sign in, and you can able to create an account through the different applications like Facebook or Google, and you can give some information. Based on that, you can able to sign up. So once you did, so you will be able to log in if you are creating accounts. The first time you can able to sign in. So once you sign in, we can able to provide some info about identify an overdose. We have different instructions, so that witness also can aware that. So and we can also giving the information for regarding the administration of naloxone, so they can aware of it. So even if the opioid victim suddenly realize that he need naloxone, he can able to trigger that. It will give the notification to the naloxone carrier. So naloxone carrier can approve that. So he'll be, if it is next to your door, he can immediately assist that before EMS reaching. So that's the way he can get help. Then immediately EMS will reach the point. They will start helping the people. And yeah, so actually time is out. I would like to, yeah.
Any questions from our judges?
Sorry?
Why would you use this app instead of calling 911?
So because if you are a next door buddy, like you are having the naloxone, it takes some time to reach the EMS people to the point. so that they can calm down and they can help it. As well as it has information like if you have seen some victim, so if you are a witness, immediately if you want to help him, so we have this app so that you are carrying the naloxone with you, you have it, you can immediately help him. So that
notifications if you're nearby. So we've also found that even with EMS available, even with these things available, we've seen that there are 30,000 deaths a year. So it's an additional help for the community that, okay, if you have somebody nearby, you can use it. A friend could be in help. You could get naloxone even before an EMS does. Definitely it tells you to call 911 and call for help and things like that, but definitely it's an additional benefit to the community.
And also we explore the data, different centers where we can get the naloxone so that they can able to buy it.
What our app wasn't able to show was the data that was available. So it shows if you go in and select for your location, it shows you the location and shows you what centers were available from the data from what we've been getting from there.
And one more thing, the beauty of the app is like variables. We can able to build the variables. That's what we did in the past. And that variable, like always, if it is on your body, like it always sends the data to the app so that it will create the model. So model is nothing but if you are not using, it will contain constant respiratory and constant heartbeat. If it is going down, so it will notify that. This is the advantage we have it instead of, directly calling 911. So if you are having this app, we can able to, save the people. Right. So thank you.
Team number 21.
Good afternoon. My name is Terry LeBlanc. This is my assistant, Jonathan. Our presentation is going to be what we call Marvel. It's a mouthful right here, as you can tell. It's a mobile big data analytics solution for retrieval and visualization based on a distributive ledger. The solution is basically to show how we can take care of treatment, prevention, and a knowledge panel so that either providers, patients, any entity based on security rights can get to the data on a single panel. Most of you that have been in the healthcare industry have run across this situation where you've got so many standards out there and you try to integrate all of these standards together and it becomes a confusion. It becomes what I call a data standards alphabet. And again, the solution is going to try to take in all of these data standards and flatten them out. What we've done is taken what big data analytics, the 9 V's of big data analytics. A lot of it has to do with, I'm not going to walk through them right here, but the bottom line is visualization. How do I take all of this data, display it in a single panel that is very meaningful to me as a user? And again, a user can be a consumer, which is a patient, a provider, the fire department, the police department, etc. Government, any government entity that has access to it, again, based on the blockchain security mechanism, has access to that data. What we're going to do right now is go through a demo, and we're open to questions anytime y'all want to stop. So let me minimize this. We're going to start off from a visualization system right here, and what we're using is Tableau. We feel very good about Tableau because it gives you a visualization in multiple forms and fashion. What we're going to show you there is we've done zero development using this tool. We've taken raw data that we've pulled out of a blockchain and displayed it together. Here's a rough map of Louisiana that is showing some patients that has problems, whatever it is, has certain risk factors. And granted, the individual, I just wanted to show you, the individuals will not show a patient, But what we wanted to show you is that the ability with Tableau is that I can click on this patient right here. Oh, wait, I should have gone this way, I'm sorry. And I can click on this patient right here. And here's the visualization dashboard. This visualization dashboard has taken the data that we've pulled from, again, a blockchain, and what we've categorized it by domains. There are multiple domains that are displayed on the left-hand side, and within those domains, we've displayed other specific data, not only from healthcare perspective, but it could be ERP perspective, it could be again, a government perspective, etc. Again, based on the security rights, that's what's displayed. Since I have full security rights on the dashboard, I will be able to see all the data. If I was a provider, this is absolutely too much information. I could display just the risk data. Oh, I'm sorry. Here it is. I'm hitting the wrong button. If I was a provider that would log into this dashboard, based on his customization, based on his security rights, I could bring him up directly to this dashboard right here, which would show, if you look at it on the left-hand side, it shows AI components, it shows medication components, on and on. And plus, this is the longitudinal data of a patient over time. Prevention at his fingertips. Once you log into this dashboard, again, based on security rights, I as a provider can drill down to my level of data that I need to make decisions that are on the fly. I only see the data. I don't know what he's doing now. I only see the data that I need to make decisions. Also, if you look at it on here, because we've categorized the domains, I can display other data that I may need, all seamlessly, directly from one dashboard. So, again, if I scroll down here, again, this is the longitudinal data of a patient. And again, this data does not have to come from blockchain. Individuals that are companies that have HIEs, I can directly integrate into the HIEs. So this dashboard here, it allows you to integrate to any existing data sets. It's just that I'm demonstrating this running on blockchain. Questions, please.
Give it up to Team 23.
All right, we are Team Techno. We are a technology service provider based locally here in Lafayette. And when we heard about CodeFest, a lot of us jumped at the opportunity at getting this. We were really excited about what's going on here. So thank you for hosting this and putting this on. We have a great team with us: Charles, Ross, Schmiel, Mike, and Katie couldn't be with us. She's a busy college student. Our application is Go Rehab. Go Rehab is a sophisticated matchmaker between those who are seeking treatment and the center that can take them in. It provides a person seeking treatment with the right center for them and sends to treatment centers potentially with potential patients that they are looking for. Currently, most sites can only show the rehab centers that are nearby. When someone's looking for a center, it can be a daunting task. They pull up Google, they see what's available. There's so many options. And when they finally find one to go to, they could take all the effort to get there, only be turned down because they don't have the criteria to be let in. Go Rehab offers more criteria to deliver a more refined list of treatment centers. It also offers organizations the ability to add more eligibility constraints. These constraints can go into user profiles that can create a matchmaking system between the organizations and the user. So we talked to a lot of professionals, and they say that a big problem is that treatment centers often has these eligibility constraints, and people don't know about it. So we want to bridge that gap. This is precisely what Go Rehab is addressing. Go Rehab has a professional profile editor, which organizations can add into their system. They can create profiles for them and enter the eligibility constraints that they want to see. These constraints can be used for the profile for the user. The user makes a profile for them using these constraints, and this is what helps out the matchmaking profile. Matchmaking profiles can give criteria like age, budgets, gender, insurance providers, mental health conditions, and other criteria, not just based on what's nearby. This is a demo of certain matchmaking that we can show. We also provide geo-demographics. This information is based on local information using data we got from here, from this set. It can show us facility types and the addictions that they treat, along with the types of addictions people face in a certain area. This is alterable. You can go through this using Power BI and select different criteria to show you different types of addiction and map out what's in a local area. Let's see. But this is not it. There's a lot more to this. This eligibility criteria can turn into a growing list of criteria that organizations can add. This adds for more refined matchmaking that will help users find more and more refined matches to see which organization is best for them. That will lead them to the best treatment center better and better as time goes on. We also make the profiles anonymous, and it's powered by BotTrain. This allows us to track patients as they go in and out of centers. This can effectively create a success matrix, data that we do not have available right now. And as more and more people and more organizations use this app, it can further define a success matrix that people can use. And users can anonymously have this profile and progress as time goes on. So we believe this information is valuable to not only the user, but also the organization. It can also offer a revenue model in the future. This data that we would be collecting as time goes on through all these constraints is valuable to many organizations that can fund the system, but also we can get funding through ads and donations. So that's our app. We'd like to give a special thanks to a lot of people that helped us out, specifically Ryan Judice and John Sumner. They were very valuable in informing us. And you guys, thanks for putting this on, and thanks for giving us a shot. Thank you.
One thing I want to say is that we did spend all night coding this, so it is a working application. We do have matchmaking functionality that actually works. The Power BI is actually developed. It's actually slice and diceable. And that's all at gorehab.techno.com right now, if you wanted to check it out.
Hey, I'm going to do it a little different. Instead of doing a demo, I'm going to let you guys play with the app right there on the phones. And if it breaks, it's Rachel's fault. So they're going to put up some slides. I'm just going to kind of talk. I'm not really good at this, so a little nervous. So we developed a tool to help anyone in distress to get treatment quicker, especially those suffering from an opioid overdose. The solution we created has two main features: panic mode and Good Samaritan mode. we're using geolocation and geofencing technology. So if somebody presses panic mode and they select why they're panicking, whether they're having a stroke or a heart attack or an opioid overdose, a broadcast will be sent out to any first responder or EMS who has this app, and they can respond to the situation. Also, in panic mode, if they have an emergency family contact set up, it'll send them a text with a link to their current location. So if they're out of range of any first responders, the family member can click on the text, see where they're at, and they can call 911 for them just in case they're incapable of doing that. Panic mode requires a little setup, so we're not really going to go into that, but we don't put any names in the setup, so we're not broadcasting any private information or patient names or anything. You tap the button, you choose a reason, and it says help is on the way. The next feature we want to talk about is the Good Samaritan mode. This is used when the user is a bystander and they notice a person who is in distress. They, they tap the Good Samaritan mode. They start the app immediately relays the data as they gather it to any first responder or emergency services personnel that are in the area. Although the app is not limited to opioid-related issues, if you hit on certain parameters, the app will warn the user of a possible opioid overdose. Once again, this data is forwarded live to any first responders or EMS that are responding. If the patient's situation changes, you have the ability to jump into the treatment flow to anything. So, for instance, if they're breathing fine, they're unconscious, and all of a sudden they stop breathing, you can jump back to the part where they're not breathing and do the CPR. Treatment was our focus. The data set we used was the National Drug Code Directory. Yes?
How does this work with the current EMS system? Essentially, you're sending out a broadcast so they can get it.
Well, anybody who has the app will get, and they're registered as a first responder, they will get the broadcast in a push notification. But they have to have the app. Not all states have it, but they do have text to 911 that we were hoping to integrate into it as well.
What's driving the head-to-toe check? Because I'm getting some pretty interesting questions.
I just, what'd you get? Oh, no, that was just something I pulled off the internet. We had a student from Rain High who was supposed to join our team in their first responder course, and unfortunately she couldn't make it. Mm-hmm. Any other questions? Thank you.
All right, so now I'm going to take the judges to deliberate upstairs. Remember, teams, to bring your jump drives up to this table now. They've migrated to the podium. So if you don't mind bringing them up here. Mr. Matthew has some forms for you to fill out. So if you want to send a representative from your team up with the jump drive and to fill out some paperwork, that'd be great.